And here, okay, I think we're live. All right. So, welcome everybody. I'm Antonio with New Grad Optometry and Covalent Careers. And I'm excited to be here with Dr. Christopher Lievens. We're going to be talking about a topic that is extremely relevant to real-world optometry and practice, and something that I know I struggled with massively when I first graduated. So Dr. Leobens is the Chief of Internal Clinics and Professor at Southern College of Optometry. Dr. Lievens has been employed in private practice, an ophthalmology referral center, and he served in the United States Air Force. He was the Chief of Aerospace Optometry at the Pentagon before joining SCO. Dr. Lievens is a fellow of the American Academy of Optometry, a Regent Chair of the Academy's Admittance Committee. He's a council member of the National Board of Examiners in Optometry. He's the co-creator of the fundoscopic grading card and currently conducts research in glaucoma, dry eye, uveitis, and contact lens care. He's got a master's degree in healthcare administration and is currently enrolled in a PhD program in Dr. Lievens is also a member of the American Optometric Association, the British Contact Lens Association, and the Association for Vision and Research in Ophthalmology. So a good bit of experience here today with me, if I could say. So it is a pleasure to have you. Thanks for joining us.
My pleasure.
So when I was in optometry school, we learned a lot of things. And one thing we didn't learn a lot about was doctor-driven dispensing.
Sure.
When I got out in the real world and started working in private practice, I quickly learned that this was one of the most important skills you can really have. So today we're going to be talking all about doctor-driven dispensing, understanding patient need, and prescribing lens technologies to meet the needs of our patients.
Sure.
So let's just get started here. First and foremost, there are tons of lenses out there, tons of them. So many options, and it can be hard to wrap your mind around them. How on earth do you stay up to date and informed on the latest and greatest in lens technology? And, where do we go to keep up with this stuff?
Well, Antonio, it's really not easy, and I do commiserate with everybody. Unlike contact lenses, with regard to spectacle lenses, they seem to never go away. You could probably still get a progressive lens that was invented 25 years ago that's on the market. So when new products come out, the old ones just kind of stick around. And so it makes the catalog of choices bigger and bigger and bigger, and it does become overwhelming. It can anyway. And so my first suggestion is immediately try to figure out what are the offerings in the practice setting that you're in. And once you know them, you can at least reach out to the reps for each of those companies to understand the idiosyncrasies of various products. Make sure that the offerings today are, if you're a decision maker in the practice, what you think they ought to be, because new technologies do come out. And if you have complete decision making autonomy, then pick a company or two, probably no more than 3, and reach out to their reps and understand what their most premium offering is, what kind of their middle of the road, or maybe what an entry level is. And if you can just understand a few things, it'll arm you to be much more comfortable when having a real patient interaction. So kind of think of it in terms of like your various glaucoma meds. Be real fluent in maybe the top 3 or 4 go-to meds, and then anything beyond that, you can always look up. But that fluency will increase confidence and really drive these discussions with patients. Honestly, I think that you're kind of hitting the nail on the head. The most common reason why these discussions don't happen in the office are just because it's overwhelming to be able to have a fluency in the litany of options.
Yeah, definitely overwhelming. And that's great advice. And, going on what you just said, I did find that just talking to reps when I first got out of school and just using, them as a resource was a great way for me just to kind of learn about maybe, just a couple of the top products. That way I knew a little bit about them, that I could be comfortable enough to make recommendations in the exam room. And, speaking of, and you kind of mentioned it, that, a lot of these lenses stay in the market. And so there's so many different options. What are some of the major lens technologies and lens options you frequently find yourself using in practice?
Sure. I would say the top three companies that we work with on the spectacle side are Essilor, Zeiss, and Hoya. Based on my own research as a practitioner, as well as my own feelings as a wearer and a patient, I am really a huge fan of the Essilor line of lenses. In particular, I really appreciate the technological advances recently in transitions lenses, and as from the experience of being a presbyope, Varilux X is a progressive lens like no other before. And I can't tell you how many ones I tried, but it stands apart from everything else because it has some distinct advantages.
Yeah, I've heard a lot about the Varilux X, and one of the big parts of it was that it was designed with the modern wearer in mind. You hear that a lot about it. The wearer who's immersed in digital devices, and what would you say is the number one complaint from patients when it comes to progressive lenses?
Yeah, it's for sure distortion in the lenses. Just the way the plastics have to be bent to get the optics positioned in a way to be able to transition from near to intermediate to far, that induces distortions. And, presbyopia is an interesting thing. I really didn't know what it was going to be like till I got it. And honestly, my predictions on what it was going to feel like were entirely wrong. It came upon me one day. It was instantaneous. And honestly, there is some emotional baggage that kind of hides behind the scenes of being a presbyope. And so the goal that I have in mind is make my presbyopes feel non-presbyopic. And that's challenging. So the only two modalities that I've been able to do that is a quality soft contact lens multifocal, and those optics are totally different between companies. And so I have my favorite in mind, but in the spectacle world, Varilux X is the only progressive that as a wearer, I do not see distortions in either channel, nasal or temporal. And I don't have to think about its use. I don't have to point my nose to see and raise my chin up and down. I just look through the lens like I did when I was 40, 41, 31, 21, 11, just like I was when I was a young adult and a child. It just works naturally. And so there is then some emotional gain, and you feel kind of younger again when you use your eyes like you've always used them and not have to find a sweet spot in the lens like honestly every other progressive I've tried in my life.
Well, I'd say everybody wants to definitely feel young, so that's an important thing for sure. But one thing when I'm seeing patients, and I hear it a lot, especially down in the optical, is I hear patients ask all the time. They even ask me as well in the exam room. Is there really a difference between lenses? Is a premium progressive really any better than a standard progressive, or is this lens option better than that lens option? And how do you convey, how do you explain that to patients? How do you convey that message to patients? Because oftentimes in the world of managed care, a certain lens might be covered by insurance, whereas another, there's, additional add-on, extra fees. So how do you explain that difference? And, this is a premium product. This
Right.
is what it's going to do for you versus, well, this is covered by your insurance, but.
Right. Well, honestly, I use that language. I say your insurance will cover you for an entry-level product, of which there may or may not be a small copay involved. But if you really want to see and use your eyes in a more comfortable way, you may have to go with an alternative product or at least an additional pair of glasses. And I think patients kind of understand that their insurance benefits, though they're very nice to have, that they're not going to offer Cadillacs. They're going to offer something that is really an entry level. And so when you phrase it like that, I think they get some buy-in and don't feel like you're trying to push a sale. You're really trying to give them solid medical advice. So beyond that, I make sure that I'm only telling them the truth. I always want to underpromise and overdeliver. And when it comes to, I try to bring things down to real world layman's terms and analogies if I have them. And so the best analogy I can think of is you could have the most robust, powerful computer on the world, but if it had a really bad monitor, that would probably frustrate you. If
Yeah, I
you could
love that.
have
Yeah.
the best smartphone on the market, brand new to the market, but as soon as the screen gets cracked, it's frustrating. So, it's not the underlinings of electronics and digital devices. It's really what we look at. And if it has user functionality and it looks good and it's easy to navigate and work with, then it tends to win in our minds. And so ophthalmic optics are exactly the same way. The technology may be sound, but if it doesn't produce clear, comfortable vision, well, that's all for naught. And so you really have to pick products with those things in mind. And when you explain that to patients, I think it resonates.
Yeah, that makes great sense. And, I think that a lot of it also comes down to, and you kind of touched on this, was, having a conversation with your patient. And I think understanding their needs is also critical in making recommendations and providing them with a great experience. So, when your practice of patients that you're identifying in the exam room, is it digital eye strain? Is it you find that a lot of patients benefit from prescription sun wear? And, how do you go about understanding all the different needs that patients have, and what does that conversation look like? Because I feel like, especially when you first get out, it's easy just to kind of get in that, I've got to do this test, I've got to do this test, I'm going to do the refraction, I'm going to put the dilating drops in, and you really don't have a conversation about what the patient is really there for.
Yeah, in fact, what you just said is what I was going to first initially say. Here's the irony of what we do. Think of your busiest patient care day, whatever that volume of patients is. What you instinctively, as the practitioner, want to do is wrap up the testing, wrap up the exam, and quickly move on to the next patient. But the irony is, the part that we would instinctively skip is what the patient values the most, which is we get all this optometric equipment out of our way. We sit face to face, eye to eye with the patient and talk to them, tell them what they have, what they're at risk for getting eventually, what they can do about it, and what our recommendations are to them. So I swear to you, I have to tell myself, okay, Chris, put on the brakes. Sit in front of the patient. I know you're rushing to get to your next ones, but give them some eye-to-eye time and tell them what you think. Because I think that when I'm a patient, I know that's what I value, but it's easy to forget that as the provider on a really busy day. I try to keep it simple. I try to keep it concise. I try to deliver it in a way that they can remember it. And for me, the top two things that I like to talk about are presbyopia and UV protection. And I try to tie those back together by saying things like, our current understanding actually tells us that cataracts actually start in the 40s and are one of the reasons why this the need for additional power at near starts. Visually, we may not notice your cataracts behind the microscope till you're 60-ish, but it actually starts the process in your 40s. And there's a way we can slow this down if we consider UV protection. We can consider it in hats with brims and protection outdoors, but honestly, for the eyes, it comes with UV protection from the sun, blue light protection, and I have some recommendations really that will tackle both of those.
Yeah, I really like what you just said there, and it kind of basically answers in a way, the next question that I really had for you, and it's all, doctor driven dispensing here, but when you get out of school and whether or not you own the practice, your job really depends on this skill, because if you're not generating any revenue for the practice, your position might not be there very long, or maybe you're, being compensated based on production-based pay. That's very common out there now. But, I guess one thing that I struggled with when I first started was just, how do you get good at doctor-driven dispensing without feeling like a salesperson or
Sure.
feeling too salesy? How do you approach this so you're prescribing solutions and not just trying to sell add-ons or upgrades?
Right. Well, I think we tend to feel less like selling and pushing products when we really understand them and believe in them. When we really truly believe that this product will help somebody's quality of life, then it doesn't become a sale anymore. And the more we believe it, that comes across in the way that we say it. I encourage folks to go out into the world and think about all the activities in which they interact with other human beings. And think about those interactions that are positive and what makes them positive. Those are the things to mimic. Some people are really good with this. So if you have a partner in the practice or a supervisor or a colleague, ask to watch them, observe them. At the very least, get your own eyes examined every year or twice a year. Invariably, you're going to pick up some things that some other people do that you don't do that you want to copy. And copying is the sincerest form of flattery, they say. The end of it, honestly, is what's potentially uncomfortable for us, which is practicing. You know, you wouldn't go to the basketball game without having a practice. You wouldn't go to a musical performance without having a practice. Well, this type of doctor-driven dispensing requires practice. So do it with your loved one, your significant other. Do it in front of the computer and just video or audio tape yourself. It is kind of uncomfortable to watch or hear yourself on tape, but you can pick up some cues that you like, and you can pick up some things that you don't like. And then at the end of the day, try it and track your outcomes. And you'll very quickly see which strategies work and resonate with the patients and which ones kind of fall flat. It's really just an exercise in practice and performance that over the course of time, I think all of us can get good at this.
Yeah, just like anything else, the more you practice, the better you get. And it makes perfect sense. You know, one thing that we hear a lot about as well, and that we really know about, is how important the optical is in regards to a practice and generating revenue, at least for a majority of practices out there, because there are different types of practices. But what are some strategies that current or future practice owners can leverage to really empower their optical to perform efficiently, increase capture rates, increase second pair sales, all important stuff?
We can do this honestly with the help of our reps. And it's across everything that we do. We could be talking about intraocular lens recommendations, contact lens recommendations, spectacle recommendations. All these companies have reps. And if we can set aside some time, they are more than willing to train us and train our staffs and be that person or conduit that actually allows us some practice and role playing. And if we're aware and listening and alert, there are programs out there every single year that are unique offerings. And they're just with the low-hanging fruit that if we just reach up, we can grab them. The best example for me is when I heard of the Ultimate Lens package early in late in 2017 and now into 2018. That to me, that's unheard of, to have a company offer the best progressive lens, transitions, the best UV, and then tell the patients, hey, if you purchase this, you can get a second pair of lenses for free. That's just crazy. When I saw that, I called my rep. I said, are you seriously offering this? And we immediately started offering that in practice. And I started mentioning it in the exam lane. And I started writing it on my prescriptions so that hopefully it would translate into real purchases, because this is a powerful offer. And really patients started taking advantage of it.
Yeah, I know a lot of practitioners have had good success with Essilor's Ultimate Lens package. You know, our practice uses it quite a bit. And, you know, when we talk about second pair sales, what would you say is the most common second pair sale that, you know, your practice makes? If it, you know, is it prescription sunwear? I mean, what would you say if you were, you know, thinking about your own practice?
In our practice, I try to make their first purchase the best quality. And if I can do that, then anything beyond that is just icing on the cake. So I really recommend the best products for them in their first pair. And if they then opt for a second pair, it's just fantastic. Now, with offerings like the Ultimate Lens package, what that kind of taught me is if you just give the patient base a reason to appreciate some additional value, they'll go after it. All you got to do is plant the seed. And to me, that was the perfect seed to plant because it's so easy. You're going to get it for free. There's no additional justification. It's you get this and you get another one. And so that is so easy for anybody that struggles in second pair sales. That just takes all the struggle away.
Yeah, it's kind of like a slam dunk opportunity in a way.
Right.
Yeah. So I want to do a little kind of not a role playing, but I know that I remember learning that the handoff between, you know, the doctor and the optical, the optician, a staff member, is one of the most important moments when you're bringing a patient down to your optical to, you know, choose eyewear, make a frame selection, etc. So can you kind of give us an idea of what your handoff sounds like?
So I'm going to describe it in a couple different ways. I'm going to describe it in a practice in which a handoff is a method that's practical and feasible. And there are some practice settings where it's not feasible. And what do you do if you cannot do it the typical way? So in a typical fashion, you have to be aware that the person coming in the room, the optician, the technician, the staff member, what have you, is somewhat foreign to that patient. The patient has a comfort level with you because they've been with you for a few minutes, but now a stranger's entering the mix and they don't have that level of comfort. And so I try to, after an introduction, Ms. Jones, this is Sarah, she's our staff member. She's going to be finishing up your exam with the recommendations that we discussed. I then try to mention something that I learned about the patient, some personal thing that we may have just talked about, as well as some personal information about the staff member. So I might say, hey, Sarah, it's interesting that I just was talking to Miss Banker and both of you like the same television show on Wednesday nights or something along those lines, so that there is some now personal connection between the two that I can introduce that's not related in most cases to the world of eyes. Then I echo to Sarah what I just said to Miss Banker, because Miss Banker heard it. I may have said it twice, but now she's going to hear it again, and she's going to know that I told Sarah about her. So it could be something along the lines of Miss Banker has some issues with XYZ, and because of that, we really want to tackle that this year, because we want to get her seen the best we possibly can, and that's only going to be delivered by using this product. And then I say, great, if you guys have any questions, I'm here. Run back to the exam room, Sarah, and call me. But I think once we get Miss Banker into this product, she's going to do very, very well. Option B, if for whatever reason you're in a setting that cannot do that, I describe it to the patient. I usually say it twice, so they hear it. I put it in my medical record, and I make sure that my recommendations print on the RX, so that if a patient walks it directly to the optical, it's front and center right there. If for whatever reason they leave and come back on a different day, it's still there. I'd rather my patients come back to me, but if some reason they decide to go elsewhere, it's still on there. And so I like the spectacle prescription, not just to be about numbers, but also to echo exactly what I want the patient to be in. And so those recommendations I really think are critical when it comes to a printed RX.
Yeah, that's great advice. And, you know, I like how you said that you kind of reinforce your recommendations several times. And do you feel like, you know, do you find it to be more effective to talk about recommendations during the exam, at the conclusion? I mean, obviously at the conclusion of the exam when you're making that handoff, but do you kind of give a recap to the patient before you make that handoff and then reinforce it? Or is it just kind of a conversation that you build right into the, you know, the fluidity of the examination itself?
In the middle of the exam, if I have a hunch that I want a patient in a very specific product, and by the way, I do talk about product names and not just by class of products. I don't just say, I think you need to be in a progressive. I say exactly which one I want you in. But I say in the middle of the exam, oh, Miss Banker, I noticed something about your eyes that I think I have a very good recommendation for you, very specific, that we'll talk about later. So I try to breed a little bit of excitement in the middle to kind of, so now they're really eager to hear what I have to say for them. And they really understand that this is tailored to them, not just something I tell everybody carte blanche. Then, of course, at the end of the exam, when I provide them their prescription, then I'm really going over the recommendations very specifically that's really suited to them and their eyes.
Yeah, I think that's great advice too, because, you know, like you said, when you make specific product recommendations, it sounds very personal, very customized to their eyes. And, you know, you're not just saying, oh, you need a progressive lens. It's you need this particular progressive lens. And then later on, because of XYZ. So it sounds, you know, it creates a nice experience, you know, for the patient, which I think is really important.
And the best thing about this whole doctor-driven dispensing is it's throughout our practice and throughout our patient base. It's not just spectacles, but if you get good at this, then you can get good at premium contacts. And if you get good at that, then you can talk about premium IOLs. And if you get good at that, I mean, it's all parallel. It's just one skill, but this skill is all throughout our approach to patients. In almost every category of a patient assessment, there's some trait that you can talk about to the patient that falls in line with this exact topic that we're talking about of doctor-driven dispensing.
Yeah, very so true. I mean, on so many different levels, even, you know, when it comes to making dry eye therapy recommendations, you know, you need this specific treatment because, yeah, so that's great advice. And so just want to ask you to leave the viewers in our audience with, you know, just top tips, not just for the new practitioner, because I think this is a skill that even, you know, seasoned veterans, old practitioners could really improve upon. So just your, you know, your top tips.
By a category. So by the category of spectacle lenses, learn a lot about free and really develop a fluency there. And then you really can talk with a knowledge about what these products are really going to offer your patients. If you have an opportunity to try them yourself, by all means do that. It doesn't mean you have to be presbyopic to know how a progressive lens works and feels. You could be 29 years old, and if you put on a poor quality progressive, you'll know what it's like and the reasons why our presbyopic patients can struggle with that product. Whereas if you put on a quality product, you'll immediately know how this is going to provide for you. It's the reason why there's a whole line of pre-presbyopic products on the market. The same is true about contact lenses. Sometimes you don't know what it's to feel like or look like till you experience it yourself. So develop a fluency in just 2 or 3. It doesn't have to be 100, just 2 or 3. That will immediately get your confidence up, get your feet wet, and then you really can start practicing and tailoring this approach to your patients that will take, ideally, little chair time, but a great deal of impact for the patient.
Thank you so much for taking the time to sit down with us today. I learned a lot, and I think many of our viewers will as well. So thanks for spending the time, and we'll have to do this again sometime.
Absolutely.
If anyone has any questions about doctor-driven dispensing or for Dr. Leobens, in particular, more than welcome to reach out to me at antonio@covalentcareers.com. I don't know if you want to share your email address or not.
Yeah, my email address is clievens@sco.edu. And if you can go to the SCO website, and I'm on the faculty list, the administrator list, and you can find me there too.
There you have it. So thanks for watching, everybody.
Thank you.